Hello, my dear friend. In this session, we are going to discuss all the expected image-based question for your upcoming INI-CET NEET and FMG exams. So, one question they ask is from the forest plot which we draw in meta-analysis. They ask how many of these following study are showing association. And the central line which you can see over here, it represent odd ratio of 1. An odds ratio of 1, I hope you all know, means there is no association. If odds ratio is 1 or let's say relative risk is 1, it is no association. So if any line is crossing this central line, all those study are showing no association. Like study 1 is crossing it, 2 is crossing it, 3, 4, 5, 6. This study is the only study which is not crossing 1. Rest all this out of this 8 study, only sixth one is not crossing it. So that's a simple image based question. We can see through it and we can simply say that only one study are showing positive association. But why is it so? The reason is that if suppose our line which indicate confidence interval, it includes odds ratio of let's say 0.8 to 1.2. Okay, देखो meta analysis, what we do in that is we combine different study data and result which has already been done. Like let's say you want to know whether increases milk, whether drinking milk increases your sexual performance or not. So if you want to know this, first thing you will do is you will search all the study which is done on that topic. And if any study result is coming between 0.8 to 1.2, 0.8 is less than 1 and odds ratio less than 1 means negative association. Negative association simply means that if you drink milk, sexual performance will decrease. Milk will prevent you from doing sex because blood supply will go to intestine and not to the organ where we want it to reach. And if it is coming 1.2, 1.2 is showing positive association. So this means drinking milk will increase your sexual performance. So if the same milk is one time decreasing sexual performance, one time increasing it, it means milk is not related with sexual performance. Try to change something else. And in between 0.8 to 1.2, you can see 1 will be there in between it. It is 0.8, 0.9, 1, 1.1, 1.2. So 1 is in the range. If 1 is in the range, it is negative, positive, both type of association. And that means there is no association. Okay. So that's why all those study where you found confidence interval including 1, like look at the first study confidence interval, it's 0.39 to 1.31. That means in between 1 come. So all these study which has range from negative to positive both side, there are no association. Only one study, this sixth one, is positive association. Okay. Then this second question is asking that if cutoff we are decreasing for a screening test, then what will be the effect of decreasing cutoff on sensitivity, specificity, PPV, NPV? Let's take a very simple example of it. You all be knowing that in NEET PG, the cutoff is now 0 percentile. So if I am lowering the cutoff from 50 percentile to 0 percentile, what will be the effect? First thing is, when we lower cutoff, more student will pass. And sensitivity means ability to include. Jैसे the guy who include other people problem in her or his life is a sensitive guy. The guy who help everyone by giving shoulder when they have breakup is sensitive. So the one who is including more is more sensitive. And when we lower cutoff, more people will pass, more people will included. So sensitivity will definitely increase. Now, there is a very simple formula by which we can correlate everything. The formula is, I hope you all know, sensitivity is inversely proportional to specificity. And the hidden formula is sensitivity is also inversely proportional to positive predictive value. And then PPV is inversely proportional to NPV. So now, when we know that after lowering cutoff of NEET exam, more student pass, so sensitivity increase. If sensitivity increase is known, then of course specificity will decrease because they are inversely proportional. PPV will also decrease because PPV is also inversely proportional to sensitivity, and NPV will increase. So we have to search out of this. Specificity increase is correct. Specificity decrease is also correct. PPV decrease is also correct. NPV decrease is not correct. NPV had to increase. So it's this type of question look difficult, but they are simple. Only thing you have to understand is in the curve, on the positive side, there will be both type of positive. This side are those people who passed. They are the people who passed. And in the past group of NEET PG, some are true positive. Those who have worked hard, they passed. But when we lower cutoff from 50 to 0 percentile, many such students who have not studied, they also pass. Like I heard this strange news that there was a guy who scored -12 mark and he got radiology branch. उसका तुक्का भी नहीं लगा ना, even his guess did not work, but still he got radiology branch. So if you lower the cutoff, those type of false positive student will also pass. Those who have not studied, they will also get the branch. So whenever you lower cutoff, false positive increases, and on the side of positive, there will be both positive, true positive, and false positive. And on the side of negative, there will be true negative and false negative. That will also be on this side. This side is true negative, false negative one side, true positive, false positive one side. And when we lower cutoff, we are including many false positive. Those students who have not passed, they are also getting PG now. So you can understand here, when we lower cutoff, we are including more people, so sensitivity is increasing. But we are including those type of students who have not studied. That means false positive is also increasing. And we are including those students who have not passed. So this is one very common question which many students do wrong. They ask true false type question, and they ask this point, that is false positive directly proportional to sensitive or not? And a student think that, array, we all have read the formula that sensitivity is directly proportional to true positive, and then there is true positive plus false negative. How come they are saying it is directly proportional to false positive? They tick it wrong. But sensitivity is directly proportional to true positive as well as it is directly proportional to false positive. It is proportional to both, which you understood, I hope, from this example, that when we include more people by lowering cutoff, we increase sensitivity. Those students also pass who have studied, and those students also pass who have not studied. So true positive, false positive, both will increase, and it is directly proportional. Now, one point I want to clear from here is, in exam, they many times give numerical on sensitivity, specificity, or just ask you to identify the correct formula. And one thing I will say in just next 15 seconds, and you will never forget their formula. To remember their formula, you just have to remember that sensitivity have true positive in the upper part, which you already remember. In the lower part, you will write again true positive and just opposite of that. What is the opposite of true? False. Opposite of positive? Negative. So you have to remember like this, true positive and then true positive and just opposite, false, negative, and you can never forget it. And if you add these two things, it become total people who have disease. तो सेंसिटिविटी का मतलब है कि बीमार में से सही पकड़े कितने गए, है ना. सेंसिटिविटी मींस पकड़ना, इंक्लूड करना. सेंसिटिविटी मींस आउट ऑफ टोटल डिजीज हाउ मेनी आर ट्रू पॉजिटिव, and we can multiply it by 100 if we want to get answer in percentage. So this is now specificity. How will you remember the formula forever? Same trick. Just remember that specificity has true negative in the numerator. Just remember this one, which you already remember. Now in the denominator, there is again we will write true negative and just opposite of true negative. What is opposite of true? False. Opposite of negative? Positive. So the same trick, true negative and true negative, just opposite of that false positive. And you will never forget this formula. And specificity have in the lower half total those people who are non-disease. तो specificity क्या करता है, जो लोग बीमार नहीं हैं उनमें से सही कितने लोगों को नेगेटिव आया वो निकाल के उन लोगों को बाहर कर देता है. तो स्पेसिफिसिटी निकाल के बाहर करता है. व्हाट डज स्पेसिफिसिटी डज? out of total non-disease, he removed those who are actually non-disease. True negative out of total non-disease. So if I hope you will not miss the formula. Just remember true positive and then denominator just opposite, and similar for specificity. Chalo. Now let's do one more question. This is the question on scatter plot. This scatter plot मतलब छितराया हुआ plot represent correlation. What is correlation? Correlation is direction of association between two variables. Like suppose I am talking about alcohol and accident. If you increase alcohol, accident will increase. So there is positive association between them. And if the line in a scatter plot is going towards this side, this is of course 45-degree angle and it is showing positive correlation. And if the line is going in this direction, let's say this direction, this is showing negative correlation. So the question here is, out of the two plot, which have a stronger correlation coefficient? Correlation coefficient, which is indicated by R, it indicate direction of association. It indicate strength of association. मतलब R बताता है कि दो चीजें अगर जुड़ी हुई हैं तो कितनी strongly जुड़ी हुई है. How strongly two things are associated. That's what R say. And here the dots are very close to the imaginary center line. So here the value of R will be bigger. R value can be here something around 0.9 and plus because it is going here. And here dots are scattered. So value of R will be less, something around plus 0.3 because they are scattered. So do remember, and one more question they ask, value of R can never be less than -1, cannot be more than +1. It only remain between them. So what both of the plot were showing? Both of the plot were showing positive correlation, but not of equal strength. Second, right plot with green dot represent more strong positive correlation. This is correct. This was the right plot. This was the right plot. And right plot is showing weaker correlation. Left plot with red dot, it is 0.9. So strong correlation is in plot, left side plot. So correct answer is C. Left plot with red dot represent more strong positive correlation, plus 0.9. Because the dots are closer to each other. And if the data is to the point, it means data is giving clear message. Okay, so that's why we always want less standard deviation, less scattering of dots. Here scattering is less, so value of R is bigger. And let me tell you this very important question which come from this thing is, they say that confidence interval and coefficient of variance, these are the two things which start with C, and both of these things, if their range is smaller, it means data is more significant. A smaller range always represent more significant data. Okay, we will discuss about this thing in separate topics. Let's not go there. But if the range is small, like in the meta-analysis plot, suppose they gave two confidence interval. One is 0.6 to 0.8 and other is 0.2 to 0.8. So which one has a stronger confidence interval, which will be showing a stronger association? So this range 0.6 to 0.8 is smaller, and smaller range means this study with odds ratio between 0.6 to 0.8, it is showing more stronger correlation. So sometimes they confuse you by giving different range of confidence interval. Do remember, smaller the range, more significant is the data. जिंदगी में बड़ी चीजें पसंद होती हैं, लेकिन दो चीजें जो सी से हैं, कॉन्फिडेंस इंटरवल, कोएफिशिएंट ऑफ वेरिएंस, वो छोटी होनी चाहिए, है ना. We like big thing, but two thing with C should be small: confidence interval and coefficient of variance. Now, what has happened to this image patient? Usually, student answer this is candidiasis, but Google it, you will find candidiasis have furrow tongue, कटी कटी सी जीभ दिखेगी, ऐसा लगेगा कि यहाँ से ये सब कट सा गया है. It will be furrow on tongue. The tongue will look like it is cut in different section. And this part of thing you can see is bull's neck appearance. Do I have a bull's neck? No, it's double triple chin. But the swelling, if it is near the angle of ear, this is mum's. And swelling here is bull's neck, which I don't have. So this is the image of diphtheria, of course. Now the question they are asking from here is, what is the incubation period of diphtheria? And why they ask incubation period? Because maximum incubation period is the duration of quarantine. This was the question in NEET 2024 also. This maximum incubation period. And when we remember incubation period, we again and again forget it. So let's try to remember it, all the incubation period together. It's very simple to remember. Meningococcal meningitis, cholera, influenza. Mnemonic is MCI. All have incubation period 1 to 3 days. But with cholera, we cannot take risk. So for cholera, maximum incubation period is 5 days. Then if you do double of 1 to 3, D for double, D for diphtheria. Diphtheria has incubation period 2 to 6. 2 to 8 is the incubation period for plague. But in the prehistoric time, we used to quarantine this plague patient for such a long duration that the patient used to die. So in the prehistoric time, it was 40 days. This question has came, so I am writing it specifically. Like in North Korea, they found one patient of COVID. How they managed it? They killed him and managed. So similarly, prehistoric 40, but otherwise 2 to 8. So 2 to 6, 2 to 8. What is between 6 and 8? 7 is between them. So 7 to 14 is for mumps and rubella. Mumps and rubella. And if you go, sorry for this. 7 to 14 is for polio and pertussis. So you can see even a teacher can get confused sometime in it. But how to remember this part? The logic is P for polio, P for plague, P for pertussis. All three are from P. So the 3 P are together. And plague is an old illness. So first plague come 2 to 8. And after plague we have 2 more P, polio, pertussis, 7 to 14. And then mumps and rubella, they are 14 to 21. So these are the incubation period. You can remember it like a flow. MCI 1 to 3, 2 to 6 diphtheria, 2 to 8 plague, 7 to 14 polio, pertussis, and 14 to 21 mumps and rubella. We are left with only 2, measles and chicken pox. And there is a rhyming there also. For measles, it is 10 to 14 incubation period, quarantine period. And for chicken pox, it is 10 to 21. So 10 to 14, 10 to 21. If you see, 14 to 21 was mumps and rubella. And if you put 10 to 14, it becomes measles. 10 to 21, it becomes chicken pox. So with this, we can remember all the incubation period. And of course, you can see diphtheria is 2 to 6. I hope you will revise it and you can remember it. So answer was 2 to 6 days for diphtheria. What has happened to this kid? Is it chicken pox, measles, rubella? First thing, chicken pox rashes are like beak of chicken, है ना, like dewdrops on rose petal. गुलाब की पंखड़ियों पर ओस की बूंदे, तो वो बाहर निकल के आएंगे. It will be out from the skin. That's why it is chicken pox. And here we can see rashes are within the skin surface. So it cannot be chicken pox. Rubella rashes are like flower rashes, फूल कुमारी कहते हैं उनको, because they usually occur on body and they don't have much complication. So it cannot be rubella rashes, face image mostly not rubella rashes. Chicken pox is gone. It is measles. How to identify? Measles are sand particle like rashes. They are within the skin surface and fused with each other. Like you can see here, rashes are fused with each other. One more difference is when we talk about measles, it is dry, which is chicken pox and rubella. Chicken pox, rubella are dry, but measles is with 4C, cough, cold, coryza, conjunctivitis. If you have child with any secretion and rashes in the skin surface, it is measles. Child with no secretion, dry, and rashes coming out, then it will be chickenpox. And here you cannot see any secretion, but you can see that the child is opening the mouth to breathe. Maybe after getting cetirizine syrup and all, the secretion has dried, but the breathing difficulty you can see. This is definitely measles because rashes are in the skin surface. Now the question here is, what is the period of infectivity, period of communicability? Why they ask this period? Because period of infectivity is needed for isolation. And isolation we do on the person who is suffering from disease. Like, let's say, suppose from your batch, Rahul went to New Zealand to meet his girlfriend. And at the airport, there was a lady doctor who suspect that Rahul is carrying virus. So now Rahul will be quarantined because he is healthy till now, and he will be quarantined till the first symptom appearance time pass away. And in case of chickenpox, first symptom can take 10 to 21 days to appear. So in chickenpox, we will quarantine that Rahul for 21 days. And now 21 days passed. He is about to come out. The girlfriend was also waiting outside the airport. But suddenly one pustule came out from Rahul's body somewhere. Where I will not tell. So now the Rahul is diseased because symptom is there. And on diseased people, we do isolation. Till how time? Till period of infectivity. And in case of chickenpox, period of infectivity is 2 days before rash and 5 days after rash. So roughly chickenpox has 6 day isolation. So now Rahul will again be isolated for 6 days, but don't be worried too much about Rahul, because in that 21 day he did setting with that lady doctor who was at the airport. And now for next 6 days they will enjoy the pustules and all, they will enjoy the stay. So this is the reason why we read about infectivity and incubation period for quarantine and isolation. Now, chickenpox is 2 day, 5 day. Measles is 4 day, 5 day. So the last image was of measles, and for measles it is 4 day before, 5 day after. Then after 4, 5 comes 6, 7. So mumps and rubella are one issue. Mumps and rubella are 1 week before, 1 week after. Okay. So, okay. The point was here, it will come back. Yes. 1 week before, 1 week after is mumps, rubella. And 1 week is 14 day, 14 to 28. Double of 1 week, 2 week. And a 2 and double of 2, 4. So anyway, you can remember D for double, D for diphtheria. So only 4 period of infectivity we have to remember, which they mainly ask. 1, 2 other they also ask, but mainly this one. Chickenpox 2, 5, 2 day before, 5 day after. Measles 4, 5, 4 day before, 5 day after. Mumps, rubella 1 week before, 1 week after. And add 1 and 1 week, 2 week. So 2 to 14, 2 to 4 week, 14 to 28 day is diphtheria. Okay, so I hope this all topic is clear. Very important for exam. Who is this man? This is John Snow. Winter is not coming, but he is the father of epidemiology and modern epidemiology. He drew the first spot map. But if they ask who is the father of public health father is cholera. Because of cholera, we started studying about this all water and food hygiene and all. So John Snow is father of epidemiology. Father of medicine is Hippocrates, and Hippo said it that walking is man's best medicine. Father of surgery in India is Susruta, and Susruta is also father of plastic surgery. Father of evidence-based medicine, first research was done by James Lind. First RCT was done by him, but he is mainly known for first RCT and vitamin C discovery and all. Okay, so that's not. Who is this? This is Ronald Ross. There was 2 doctors who are associated with malaria investigation and diagnosis. One is Charles Laverne and other is Ronald Ross. So Charles Laverne find it out first of all that mosquito have plasmodium. And what does Ronald Ross find out? He find out that mosquito transmit malaria. So these are the 2 people who have different contribution. Okay. And he proved that mosquito have the sexual life cycle of malaria occurring, mosquito asexual in human. So this is Ronald Ross, who is related with malaria. Then this is the beautiful James Lind. And Lind is the one who first RCT was done by him, and he find out that bleeding gum is due to not eating citrus fruit, not due to vitamin C deficiency. Okay, he divided 12 sailors into two group of ticks. In one group he gave only milk and milk product, in other group he gave citrus fruit only, and he found the group he gave citrus fruit don't have bleeding gum. So he did first RCT and proved it. Do you remember James Lind? He is with prevention of scurvy. Collagen synthesis defect occur. I myself was having bleeding gums since some 4 or 5 days back. I was suffering from this thing. So it's a common illness which can occur. You have to take multivitamin for 1 month as a treatment. This is Bhore Sahab. You can see the sun rising from his head also. And Bhore is the one who gave who said that we don't need doctors in India, we need social physician. What does it mean? It means those doctor who will go to the village, eat with villager plate, know the village problems and people problem from the root cause. So that's why Bhore started 3-month rural posting in MBBS. Okay, and his committee is known as Health Survey and Planning Committee. No, Health Survey and Development Committee. So Health Survey and Development Committee is Bhore. But if you see Health Survey and Planning Committee is the name of Mudaliar. So how will you remember it? These two different committee, Mudaliar and Bhore. Point is very simple. Bhore in Hindi means sunrise, which occur first. And you can see sun rising from it also, so you can remember that thing also. And if you look alphabetically also, development D come before P, planning. So first committee was Bhore, and Bhore is Health Survey and Development. Second committee D, then P, planning is Mudaliar. And Mudaliar and Bhore both said that we need one PHC at 40,000 population. Mudaliar also said that we need Indian medical services same as IAS. And Bhore said 3-month rural posting. So these are the two committee which is confusing. I hope you remember Bhore first, sunrise. So D first come, and planning is Mudaliar. Second point, remember they again and again ask this question, multi-purpose worker committee is which committee? So when they ask multi-purpose worker, this is Kartar Singh, because only one committee recommendation was completely accepted by Government of India, which was Kartar Singh committee. Kartar Singh said ki we don't need 3 different workers for malaria, family planning and TB. Let's merge them and make them multi-purpose. Was it a good recommendation? Of course not. If you put 3 people work on 1 person, quality of work will suffer, and as a result, malaria and population and other issues which was being dealt by them, they did not recovered well in India. But because they were asking of cutting fund and Indian government was also focusing on that, so they accepted it. This person, multi-purpose worker, you will find him at sub-center. I hope you know he make malaria slide, and he make malaria slide by which type of surveillance? Active surveillance. He go and search for hidden case. And in the malaria slide, they ask this question, which slide tell about species? Is thin slide or thick slide? So thin slide means you rotate the upper slide very close. So you can see the fine detail in thin slide only. So species is detected by thin slide, and in thin slide, Guyamja stain is better than acridine orange stain. Thin Guyamja staining slide tell about species. Now from the species part, they also sometimes give you peripheral smear and ask. In micro, they question come. So if they gave banana shaped gametocyte, or if they say gave headphone shaped gametocyte, these both are Plasmodium falciparum. But if they said that in the RBC there are multiple dots and all, this is Vivax. Okay, so Vivax will be like this, and falciparum will be these two things. I hope you will remember. Now, which organization logo is this? I bet you will tell it wrong. Try to guess it. This is organization, not WHO. WHO will have a snake and a ladder. This is UNDP, United Nations Development Program. And UNDP, UNICEF, and UNFPA, United Nations Fund for Population Activity, which fund our family planning program, is UNFPA. UNICEF funds seed and manure of applied nutrition program, and UNDP funds sustainable development goal. And all these three UN, their headquarter is in New York. So do remember their work and headquarter. Next, this was UNDP, which funds sustainable development goal. If you saw blue color mother child together, that is UNICEF. And what does UNICEF fund? I just said seed and manure of applied nutrition program. It fund mother and child health program also. Chalo, so this was, where is the headquarters of UNICEF? We just read New York, UNICEF, UNDP, UNFPA. This is World Bank head logo, and W for World Bank, W for Washington DC. Anyway, what is the international currency of the world? Dollar. Why? Because in the Washington DC, we have headquarter of World Bank. If imagine that World Bank headquarter will be in Patna, Bihar, international currency will be rupiah and international language will be Bhojpuri. This is WW, World Bank, Washington. Okay, so this was that. Now, what is this fund for population activity? What are they saying? They are not paying for sex. They are saying we should, in some country, increase population, some country decrease it. So that's why they said not population control, but United Nations Fund for Population Activity. And where is the headquarter? We just read all the three UN are in New York. Then ILO. So it's International Labour Organization, not Love Organization. And ILO, L also stand for Lal. And Lal is a Hindi word for red. So ILO and Red Cross will be together because they both are Lal Lal. Then we might not know their headquarter, but we know where is WHO headquarter, Geneva. And then there is UNAIDS. In 1980s, South Africa said that WHO is not, AIDS is not a disease. WHO has created it. Why South Africa said so? Because no one died from HIV. What is the most common cause of death in HIV patient? That is tuberculosis is the most common cause. So because no one dies, so they said WHO created AIDS. You can use this weird story to remember that wherever there is WHO, same place will be UN. So 3 UN are in New York, but UNAIDS, because WHO created, these 4 are in Geneva, Switzerland. So we can remember these 4 together. Sorry, Geneva. This organization, NEET 2024 question, has, you can see both Congress and BJP together. Another student told me, sir, this is the logo of National All-Party Unity. This is leprosy eradication program, because we have eliminated leprosy in 2005. And this is eradication, not elimination program. Why we say that we have eradicated? Because the criteria for elimination is if we have less than 1 case per 10,000, it means we have eliminated leprosy. And currently the prevalence of leprosy in India is 0.66 per 10,000. So we said we have eliminated according to the criteria which they ask again and again. This is the multiple drug therapy of leprosy. So MDT, multiple drug therapy. Yellow color mother child is Janani Shishu Suraksha Yojana. How will you remember? This is Shishu. Shishu means child who keep on doing susu. And susu means urination. And due to susu, the color of logo is yellow. So blue color mother child, UNICEF. Yellow color susu is Janani Shishu Suraksha Karyakram or Yojana. JSSY and JSSK are same thing. Because K for Karyakram, Y for Yojana, both means program. So they are the same thing. And what we do in JSSK, I hope you know. In JSSK, JSSY, we provide 3 things. Free ambulance, free food, and free treatment. So what we do in it? Do we give monetary benefit? Monetary benefit we give in Janani Suraksha Yojana. And early and exclusive breastfeeding to newborn. This is the program, sorry, MA. In India, this is Mother Absolute Affection, which is focusing on early exclusive breastfeeding. And in the world, there is Baby Friendly Hospital Initiative, BFHI of WHO, which focus on early and exclusive breastfeeding. So the facility of JSSY is ambulance, treatment and food. And the logo of JSSY is yellow color mother child. But if you found white color mother child, we consider white color as foreigner. That is BFHI. So there are 6 logo where you can find mother and child together. One by one we will discuss it, and in the end I will revise all those 6 logo with mother child so that you will never confuse. But still, let me tell you one summary of all the 6 logo. Yellow color mother child JSSY, blue color mother child UNICEF, white color mother child baby friendly hospital initiative, black color mother child is 𝐿क्ष्य program, incomplete mother child is PM Matru Vandana Yojana because the program is also incomplete, launched but never implemented. So it is incomplete mother child, in which we give 6,000 rupees, 2,000 at 6 month of first there is 3 installment. 2 installment we give before delivery. First installment at 12 week when mother come for first ANC checkup, and second at 6 month of pregnancy. Then the third installment of 2,000 we give at 6 week after delivery. So this is incomplete mother child Matru Vandana Yojana. Then there is this green color mother child, which is Anmol ANM online. This is a tablet based software for ANM data entry. If you find red color mother and in the lap red color child is sitting, that is आंगनवाड़ी program. ऐसा लगे जैसे होलिका प्रहलाद को जलाने ले जा रही है, and it's like some mother is burning some kid, है ना? It's like that red color, that is आंगनवाड़ी. So that's, I hope माँ और बच्चे का प्रोग्राम सारा याद हो गया होगा. एक रिवाइज करते हैं. Black color 𝐿क्ष्य, white color BFHI, green color Anmol, blue color UNICEF, white then there is incomplete mother child is Matru Vandana, and red color mother child is Anganwadi. Okay, so these images will come in the discussion. If they gave a ribbon which is pink in color, that is breast cancer awareness. If they give a ribbon which is red in color, that is NACO program. And if they give the ribbon where the ribbon is red color but the ribbon is having a very long tail like this, this is the logo of Sankalank. Sankalak means compilation. So this program focus on compilation of national registry data from 2017 to 2020. And if they give small tail, this is NACO. Big deal, Sankalak compilation, national AIDS data. So this was the logo of awareness about breast cancer. Pink color logo is for awareness. Now, can you see that fire effect? Mother and child sitting in the lap. होलिका प्रहलाद को ले जा रही है जलाने. So this logo is the logo of Anganwadi program, and Anganwadi come under ICDS, Integrated Child Development Services. ICDS also used to have midday meal program, but midday meal is now renamed as PM Poshan. And in the PM Poshan, we give, just like midday meal, half protein, 1/3 calorie. Why more protein? Because I hope many of you know the reality of India. Female and children are usually eating rice in the rural part. They are not taking much protein source. So we give more protein, less calorie. Okay, more protein, less calorie. Half protein, 1/3 calorie. And in PM Poshan, the new thing which has been done is, they said we will also give meal to preschool children. Preschool plus 1 to 12th. But the problem is preschool children go to Anganwadi. So, and up to which age children go to Anganwadi? Up to 6 year, not just 5 year. Up to 6 year children go to Anganwadi. So the government say anyway they are not going to come to school. Let's give them meal in the school. So this is the new thing preschool has added along with 1 to 12th class. This is PM Poshan. There is one more confusing program from here, INI-CET Poshan, which give 1,000 rupees to TB patient nutrition. So this is the old logo of midday meal, which is now PM Poshan, about which we are discussing. And the INI-CET, this INI-CET is a very interesting word. INI means no, CET means loss of body. So if they say INI-CET, loss of body occur in which disease? TB. They are talking about TB program. If they add Poshan word, Poshan is a Hindi word which means nutrition. So here they give 1,000 rupees per month. Previously it was 500. Now it has increased. And if they remove the Poshan, only give INI-CET, only this, This is the reporting program for TB patient, and this reporting can be done by private, government, both doctors. And if you will report on Gmail or WhatsApp also, you can report the patient and you might get some money for the referral also. So INICET is reporting program for TB cases. Okay, I hope you will remember. And to confuse you, they can give one more word, निश्चय. निश्चय is a Hindi word which means to be sure of. What does the government want the mother to be sure of? They want them to be sure of their pregnancy. So निश्चय is urine pregnancy test kit, UPT kit, distributed by ASA for detection. And one of the guy in Philippines, he said me this mnemonic that, sir, between निश्चय and निश्चय we can always remember, because in निश्चय S is coming first. S first. And from S he thought sex. And from sex, of course, there will be pregnancy. So निश्चय is the UPT kit which is thinking of sex and then pregnancy. So UPT kit, because S is coming first. But if you know Hindi, the meaning I think is obvious. निश्चय is to be sure, so it is UPT kit. I hope you will not confuse. Now, this was the midday meal, which is now PM portion. If this is blue color circle, this is diabetes awareness. Blue color circle. Okay, I hope the option will be there. Yes, diabetes awareness. 5-leaf is also in marijuana plant, and this is also in this program PMJ, Jai Ho PM Ki. This is Pradhan Mantri Jan Arogya Yojana, People Healthy Scheme. And what the government want to say by this 5-leaf, they want to emphasize on 5 lakh money, which is given in the insurance. And this 5 lakh insurance is for BPL family or economically weaker section family. This is for economically weaker section family. The difference is BPL people are those family where average 5 people are earning less than 7,000 per month. And economically weaker section are those people who are earning less than 10,000 rupees per month. But for your PG reservation, NEET PG, the criteria of economically weaker section is different. There the criteria is those people who, in which they or their parent are earning less than 8 lakh per year. Then you are economically weaker section. And here it is 10,000 per month. Then they are eligible for PMJ. So the two have different terms, but I hope you will remember 5 lakh EWS family. This is the insurance program. Then in one exam they ask, what is the full form of NITI Aayog? This is National Institution for Transforming India. T is for transforming. One more question has came from here is, it replaced which program? So NITI Aayog replaced National Planning Commission. So till 2014, there was National Planning Commission of India. And as soon as BJP came, they changed the name from National Planning Commission to National Institute of Transforming India. So do remember it, okay? This was Transformation, National Institute of Transforming India, Transformation Institute. This is Lift Kara De program of Congress, insurance program before PMJ. PMJ is 5 lakh insurance, and this was Rashtriya Swasth Bima Yojana, which is 30,000 to 1.5 lakh insurance. And this was for BPL family. Okay, so that was PMJ. This is Rashtriya Swasth Bima Yojana. And if you see this logo, children play with leaf na. So this is Rashtriya Bal Swasth. Bal means children health program. Rashtriya Bal Swasth. And in this program, Anganwadi, ASA, and Ayush doctor, all three work. They do the screening for 4D. And after screening, if they found any problem, they refer the child to DEIC, District Early Intervention Center. What is this 4D? Deficiency disease, defect since birth, developmental anomaly and disabilities, or diseases of childhood. है ना, बचपन की गलतियां नहीं, बीमारियां. Okay, so these are RBSK, RKSK. They see government think that when you were in class 9, 10th, 11th, 12th, adolescent, तभी तुम पेंचे लड़ाते थे. That is the time when you play kite and try to entangle with other people. So this is adolescent playing kite. And in the adolescent program, we have two things. Adolescent friendly health clinic, which is 1 day per week at PHC and 5 days per week at CHC, separate OPD for adolescent. Because remember your time when you were having your first crush in adolescence, or second, third, fourth crush. Can you go to doctor in front of other patient? Can you express your feeling? No, na. So that's why government care for your feeling and gave you separate OPD, 1 day per week at PHC, 5 day per week at CHC. Same timing, there are geriatric OPD also. Old age OPD, NCD OPD is also in NCD OPD come under which program? NPCDCS. We will show you the logo. CDCS is cancer, diabetes, cardiovascular disease, stroke. So in both this program, 1 day per week at PHC, 5 day per week at CHC. Then RKSK also have one more thing, ARS, adolescent reproductive and sexual health. So how does the government take care of your sexual health? They make adolescent group who will hold monthly meeting with panchayat and school teacher, and they will try to raise their demand of toilets and other facilities, and the school teacher will try to tell them about sex education or menstrual hygiene. So this is ARS and AFHC, which come under RKSK. Chalo. Next is India Newborn Action Program. This is a warmer which was renamed from warmer to Newborn Care Corner. So under this program, government mainly increase bed facility to infant. So what is Newborn Care Corner? This is 1 bed at PHC. And now let me see the question. The question is just the logo. So this is INAP program under which there is Care Corner. 1 bed of warmer at PHC is known as Care Corner. Then there is Newborn Stabilization Center. This stabilization center is 6 bed, 6 to 8 bed at CHC. And then there is Newborn Special Care Unit. This special care unit is 12 to 16 bed at district hospital. So how will you remember it? Very simple. First, we need to give care to the child. So Care Corner. After care, we try to stabilize the child. And if the child is not stabilized, we will give special care. So we all know PHC is primary level with subcenter. This question has also been asked. Subcenter and PHC, they are primary level. Then CHC and district hospital are secondary level. But district hospital had 4 or 5 CHC under them. So PHC come first, then CHC, then district hospital. Care, then stabilization, then special care. And see the bed, very simple to remember, 1, 6, 12. So say it with me and you will remember it. 1, 6, 12. Care, stabilization, special care. PHC, CHC, district hospital. And you can remember it. Chalo. So this is INAP program. This is the logo of radiological waste, nuclear waste, radiological waste. And for radiological waste, which goes under yellow category, the best method to disposal they ask, which is collect and send it back to manufacturer. But if you cannot send it back to manufacturer, then you can recycle it. And if you cannot recycle it, then you can mix it with cement and lime. Mixing with 15% cement and 15% lime will convert the waste into block, cemented block. And now it will not contaminate the environment. Because if you bury mercury in the ground, which occurred in Tamil Nadu, one Hindustan Liver company was there who buried it in the ground, and then people started developing cancers, trees started having less. So we cannot bury radiological waste. So if we cannot bury it, either send it back or recycle it or mix it with 15% cement lime and make it inert. Inert ka matlab hota hai susupt avastha, which will not contaminate the surrounding. That is inert. So that is inertization process, which has been asked also. Do remember. And under yellow category, 6th thing come. If you remember yellow, biomedical waste is simple to you. Remember it by a story. Suppose after taking class, I am going out. A truck got attracted with my tummy, crushed me. Now with my crushed leg, if I go to your hospital, you will cut it and throw the anatomical waste in yellow. The blood which will come out, liquid waste, that will also go in yellow. It will contaminate the bedsheet. So now bedsheet will be known as soiled waste. Soiled matlab ganda. Bedsheet ho gaya ganda. So all the soiled waste also go in yellow. then you will use some drug and medicine in me, and if any drug is left or expired, you will throw that also in yellow. Then you will send my blood for culture in microbiology so that you can start proper antibiotic. So all the microbiological waste, including the dis also, the culture plate and medium, all go in yellow. Okay, so now these are the 5 things, and last thing is nuclear waste, which goes in yellow. Let's revise the story. Anatomical, liquid, soiled, microbiological, expired drugs, and radiological, all 6 go in yellow. They ask this confusing question: where will you throw the plastic wrapper of syringe? So plastic wrapper is without any blood or contact of contaminated thing. That will go in black color garbage bag. It is not a biomedical. Where will you throw the needle with fixed syringe? Needle with fixed syringe goes in white. White has 4 type of sharp thing: blade, suture, needle with fixed syringe, and scalpel. All 4 goes in white. Only 4 thing goes in white. These 4. So that was the e-waste, the nuclear waste, radiological waste, and this is the logo of the biomedical waste. This is biomedical waste. If you see this part, this is biohazard, biomedical, and if you found this part, this is radiological waste. So biohazard have this sharp thing coming out, biomedical waste. What is this logo? This is very interesting. What is red thing coming out? This is life coming out. This is death, Life and Death Registration Act, under which we have to register within 21 days. Where do you report birth and death? At subcenter, PHC or CHC. Birth death reported at PHC under civil registration system. And where do you report marriage in village area? We report it at subcenter. In urban area, we report at subdivisional magistrate office. And if you want to come for love marriage and you don't have any witness, do let me know. This is my phone number. I can help you with the situation. Do remember. And which data reporting method do not tell about death rate? Census never tell about death rate. In census, we take sex ratio, socioeconomic status, but it don't do that. And which data recording method tell us about birth rate and infant mortality rate, MMR, and other things? That is SRS. Sample registration system is dual data reporting method. First an ASA collect data, then some supervisor also collect it. And by this dual data recording method, we find IMR and MMR of India. So these are the various data reporting used. This is Manak Path Padarsak, the logo, which in future all of you are going to be rich. So you guarantee, personal guarantee I can take. If you have doubt, call that number. So in future, you will donate silk sari and gold jewelry to your beloved wife or to yourself also. And that is the logo of BIS, Bureau of Indian Standard logo. This is day carrier or vaccine carrier. Vaccine carrier has 4 ice pack. And they ask this question, how much maximum they can carry? Each ice pack can carry 5 ampule. So maximum vaccine carrier can carry is 20 ampule. Okay. If they give day carrier, it will have only 2 ice pack. It has 4 ice packs, vaccine carrier. And how much maximum it can carry? Maximum is 20, because 5 into 4, 20. But average they carry 3 to 4 for each ice pack. And if you multiply 3 to 4 with 4, it will come 12 to 16. So vaccine carrier average they carry is 12 to 16. But maximum they carry is 20. Do remember? Okay. Chalo. Next. Of course, this is vaccine vial monitor, which tell whether temperature is monitored, maintained properly or not. Main question is, if it is same color as outside and inside, same color, will you use it or reject it? Same color is always rejected. You are right. If it is lighter, then we can use. If it is darker or same color, we reject it. So how many of them was discarded? Only the 2 last. These 2 last options are wrong. 2 last are rejected. These 2. We can use the first 2. The dose of BCG vaccine which nowadays we are giving is not 0.1 ml. It is 0.05 ml up to 1 month. And when you give it, there will be this 246 abscess ulcer scar. At the 2-week, abscess will form, it will ulcerate, and then scar formation will occur. What is the diluent which we use in BCG vaccine? The diluent is normal saline. जैसे ही बच्चा पैदा होता है हम उसकी जिंदगी थोड़ी नमकीन बनाना चाहते हैं. As soon as the child is born, we give BCG, and we want to make the life of child a bit salty, so we give normal saline for that. There is 2 more diluent which you should remember. Diluent in MR vaccine is sterile water, and diluent in Japanese encephalitis is phosphate buffer solution. So how will you remember it? Very simple. M for MR, M for mother love. माँ का प्यार. And how is our mother love? Like sterile water. No matter how much your mother is angry with you, just press her leg for 20 minutes, she will melt like ice cream. So M for MR, M for mother love, like sterile water. If you write JE, in writing JE there is Japanese. So P for J, phosphate, and J for JE. So in the name you can see Japanese encephalitis have phosphate buffer solution as diluent. Okay. What is this logo? Which has only child in the world who is happy with an injection in his hand. This is Mission Indradhanush, which is for 7 vaccine preventable disease. In the early stage, it started for 7 disease. Very simple to remember. 3 are DPT, 4th is measles, and the 3 are those which are given at birth. What are given at birth? BCG, Hep B, and OPV. And because these are given at birth, for these 3 vaccine, ASA don't get paid. ASA don't give vaccine, Anganwadi worker don't give vaccine theoretically, but they are still paid for it because ASA work as motivator. And why they are not paid for these 3? Because these are given at birth, and at birth, mother and mother-in-law will be in the hospital. तो आशा किसको मोटिवेट करेगी? ससुर जी को. Whom the ASA will motivate? Father-in-law. There is no one at the home. So for the birth vaccine, ASA don't get paid, but she get paid for other vaccine. So this 7 vaccine was initially there, but now we have intensified Mission Indradhanush 5.0, which include all the vaccine of National Immunization Schedule. Earlier it was only for 7, now it is for everything. This is the logo of National Disaster Management Authority, and this disaster management, of course, come under Home Ministry. Mota Bhai Amit Shah is looking over it, and Prime Minister Modi is the nodal person who take the decision. But at the district level, who will be the head? Will it be the Chief Medical Officer, Medical Superintendent, or District Collector? So out of CMO, Medical Superintendent, and District Collector, who know the least about these things, that will be made the head. District Collector is the head of I program. District Collector is the head of Disaster Management Program. These 2 things come under District Collector. Disaster Management and I program. Chalo. So let's see now some entomology images, because micro, PSM, they both ask question from it. If you saw this is of course Aedes, but the interesting question is they ask which mosquito have spotted wing. And you can see in Aedes there is no spot on the wing. Wing is spotted in Anopheles. This is our tiger mosquito because it has the stripes, and only mosquito which is daytime biter is Aedes. Now, what are the disease transmitted by Aedes? Very simple to remember. CD, chikungunya, dengue. Then YZ, yellow fever and Zika virus, CD, YZ. And last is Rift Valley fever. With Zika virus, 2 things can occur. First is Guillain-Barré syndrome will occur. Second is, imagine me as a pregnant mother. Now, if I develop Zika virus infection in my pregnancy, तो मेरे लौंडे की होगी छोटी मुंडी. My child will be born with a small head. Microcephaly of newborn will occur if I develop Zika virus thing. So these are the 5 diseases with Aedes. Now, of course, one of them was West Nile fever, which Aedes transmit. Then one more thing is 𝐂𝐿. Sometimes they ask, how will you identify 𝐂𝐿? 3 ways. First is there will be hair on the back. You can see there is no hair here. It is saved. But if you see hair on the back, that is 𝐂𝐿. And it's like Anil Kapoor of Insect Kingdom. And then second thing in 𝐂𝐿 is golden brown bum. And there will be a hump. Like here also you can see a hump. He's sitting like this. So hump will be there, no stripes, golden brown bum, not white black, and hair on the back, that is 𝐒𝐿EX. 𝐒𝐿EX transmit 3 disease, JE, filariasis, and West Nile fever. So I always used to get confused between West Nile fever and Rift Valley fever. And you saw it right now also, just for the demonstration, I was confused in this question, answering this question. When I say this is 𝐒𝐿EX, because it has white black stripes, if I am saying it is 𝐒𝐿EX, which disease will 𝐒𝐿EX will transmit? Very sorry. If I am saying this is black white stripes, Aedes, kindly forgive. So which disease Aedes transmit? Aedes transmits �C𝐷𝐌𝐻. So yellow fever is Aedes is transmitting. And who transmit West Nile fever? That is 𝐒𝐿EX. So how to remember this difference of West Nile and Rift Valley? To help that, one student Divya gave me a very good mnemonic here. Ki Nile can be remembered as Nali. Nali is a Hindi word which means sewage area. Tatti ka pani is sewage. And potty water is sewage, dirty water. And dirty water goes in Nali, sewage area. So 𝐒𝐿EX is the mosquito which we called as nuisance mosquito. Why we call it nuisance? Because it breed in dirty water. जब इसको ठरक मचती है तो नहीं देखता है कि कैसा पानी है, गंदे पानी में छपा छप कर लेता है. So because it breed in dirty water, nuisance mosquito. And West Nali means drainage area. So we can remember West Nali fever is by 𝐒𝐿EX, Rift Valley fever is by Aedes. So 5 disease by Aedes is �C𝐷𝐌𝐻 and Rift Valley. 𝐒𝐿EX 3 disease, JE, filariasis, West Nali fever, N for Nali or N for Nile, N for nuisance. You can remember like this also. Nuisance mosquito, Nile, N is common. Chalo. This is the glowing transparent mite. To remember mite, diseases transmitted by mite. In my MBBS, I used to make this mnemonic PSM sada hua, because I used to hate this subject a lot. PSSM. M is for mite. P is rickettasial pox. S is for scrub typhus, which is caused by Orienta chuchu gambuchi and transmitted by trombiculid mite, separate type of mite. And then this second S is the scabies, which is by Sarcopithecus scabies and transmitted by itch mite, which occur mainly in this bungalow, cubital fossa area or inguinal areas like that. This occur. And if there is scabies in any one family member, there will be itching in other also. And in the scabies, you can see the track on the skin, track of passing Sarcopithecus scabies. So pox, scrub typhus scabies is by mite. One more student in one of my coaching earlier classes suggested that, sir, we can remember it as RSS also. Rickettasial pox, scrub typhus scabies. So it's all up to you. You can remember it by RSS or PSSM. My suggestion is remember both the mnemonic. Then you will remember the full form. P and R, rickettasial pox, scrub typhus scabies by mite. Don't forget. Then this was the mite, and mite transmit rickettasial pox, scrub typhus. Both A and B is transmitted by mite. Correct answer is D, because both A and B will be transmitted by it. What is this? Dekho, this is the sophisticated mosquito. What does it mean? Sophisticated is Anopheles. Why they call it sophisticated? Because it only breed in clean water. Okay? No dirty water. Okay? No dirty talking. Only clean water. And one more thing you can see it here is, whenever Anopheles bite now, it first lifts its ano, then bite. That's why there is an angle of 45 degree. Ano, then Phyllis. So he don't like to touch our dirty skin also, okay? No touching. So that's the sophisticated mosquito. And they can ask, kiski chunri mein laga hai daag? Which one has a spotted wing? So you can see spot on the wing of Anopheles, black dot. And it transmits malaria. So this is Anopheles. But malaria can be of 3 types. One is urban malaria, one is rural malaria, and other is forest or hilly malaria. And the transmitting agent are different. If it is Anopheles stephensi is urban malaria. If it is Anopheles kulki faciens, rural. And if it is Anopheles fluviatilis forest, so how will you remember it separately? My friend Ankur Jansar, who is a good biochemistry psychiatry double MD person and very good friend of mine, used to say it in one of our episode together, कि fancy people with more fashion and all live in urban area. So fancy. And I used to think stepmothers in urban area more. So step fancy urban. In rural area, you will find more cow, buffalo, milk, calcium. So where is 𝐒𝐿𝐷 rural? And in forest hilly area, you will find more flowers. So fluviatilis forest. Okay, sure. Next is this larva. It is floating parallel to the water surface. If it float parallel, this is Anopheles. Why it float parallel? Because Anopheles has rudimentary breathing tube. The breathing tube is small. And there is one more organ in our body also. क्या है वो छोटा सा जो नीचे लटकते रहता है, that small organ which is hanging below you, below all of us. Appendix, very good. That is also rudimentary now. So similarly in Anopheles, the breathing tube is small and rudimentary. So Anopheles cannot hang from water surface. It only have to float parallel. So parallel floating Anopheles due to rudimentary breathing tube, Culex and Aedes will be seen hanging from it. Which is this? This is sandfly. Why they call it sandfly? Because there are golden hairs, and if you see it from distance, it looks like skeet has put sand particles on the body. Sandfly, which is phlebotomous, transmit 4 diseases, which you can remember by just saying it with me. Oh, Kala Azar. Say it. Oh, Kala Azar. Why this mnemonic? Because O stand for Oriental sore. Second O stand for Oraya fever. And Kala Azar is visceral leishmaniasis, but there is one more thing, topical leishmaniasis also, which is transmitted by phlebotomous sandfly. So remember, Kala Azar, the mnemonic. And there is very long leg of sandfly, feather-like structure on the wing. So this is totally different from mosquitoes. Answer will be visceral leishmaniasis. By this is our childhood friend Dheel, June, louse. And louse transmit 4 disease, which you can remember by the mnemonic POT. Okay. P for pediculosis, white dandruff-like things on eyebrows and all. Pediculosis. E for epidemic. Power is there. Power is there in epidemic, big thing. So epidemic causative organism is Rickettsia prowazhaki, because there is a lot of power, prowazhaki. And starting from outer surface, epidemic, power, prowazhaki by louse. Then E is for epidemic typhus, R is for relapsing fever, and T is for trench fever. And trench fever is also known as Quintanilhac fever, because the causative organism of trench fever is Bartonella quintana. So it is Quintanilhac fever there. Now, what is this louse mnemonic? Very simple. Pediculosis, epidemic typhus, relapsing fever, trench fever, POT. Why I made this mnemonic? Because remember your childhood days when you used to take out head lice and kill it. It used to produce a sound of PAT. So the mnemonic is also PAT. And then खून फैल जाता था नाखून पे, है ना? There will be blood spattering after killing it. PAT. So do you remember PAT for louse, RSS and PSSM for mite. Okay. And then there's one last thing which you have to remember. This rat flea. 3 insect mnemonic only I am telling in this whole session. Only 3 insect. Very important. In this rat flea, to remember the disease transmitted, which is bubonic plague. Let's revise. And if you know it, tell it. What are the other diseases? Hymenolapsis. And then endemic typhus. Endemic typhus is also known as murine typhus. The other name of endemic typhus is murine typhus. So they ask, what is the causative organism of endemic typhus? Endemic typhus causative organism is Rickettsia typhi. How to remember it? Because endemic, epidemic typhus can be confusing. endemic. Typhoid is endemic in our country, so typhoid endemic. And epidemic, big thing. So 𝐒𝐻𝐂𝐝 is epidemic. Now this four disease can be remembered by thinking that suppose Chota Bheem is sitting over rat flea. This is Chota Bheem sitting over it. And this is coming out from Chota Bheem. What is this coming out from Chota Bheem? This is the Gada of Chota Bheem. And you all must have watched Chota Bheem in every language. It is there. Chota Bheem, Chota Bheem, Chota Bheem, Bheem, Bheem. It is our local hero, endemic to India. That's why it transmit endemic, like that you can associate. Endemic typhus by rat flea, epidemic by head lice. Okay, so the difference should be clear. Endemic Rickettsia typhi, epidemic Rickettsia 𝐒𝐻𝐂𝐝. And I hope you will remember why this Chota Bheem I am making. Because if you see BHEM, Bhem, Chota Bhem, B for bubonic plague, H for hemorrhagic, E for endemic typhus, M for murine typhus. So the mnemonic become Bhem. Okay, that is for this rat flea. We'll come to this Imran Hasmi, but before that, answer this. How will you differentiate between hard tick and soft tick? Please pronounce the name carefully. कैसे पहचानोगे हार्ड टिक और सॉफ्ट टिक को? कुछ क्लास में बच्चे बोलते छू के पता लगा लेंगे कि सर कि हार्ड टिक है या सॉफ्ट टिक. मैंने बोला हर चीज नहीं छू रहे. यू कैन नॉट टच एवरीथिंग. हियर यू कैन नॉट टच. हाउ विल यू सी? हाउ विल यू आइडेंटिफाई? वेरी सिंपल. In the hard tick, head will be coming out. But in the soft tick, head is covered in a back covering scutellum. Head is inside the skin. In soft tick, head will be not out. In hard tick, head will come out. So H for hard tick, H for head coming out. That is hard tick. And if you don't see the head, that is soft tick. But similar to hard tick, there is one more tick. Now you can call hard tick as deer tick. So it is deer tick or ixoid tick, which is similar to hard tick, which look exactly the same. And we will read the diseases by them one by one. Hard tick transmit Cassandure forest disease, which is known as monkey disease. It also transmit Rocky Mountain spotted fever. Anyway, Rocky was a hard guy, na? Salam Rocky bhai. So hard tick Rocky Mountain spotted fever. And the causative organism of Rocky Mountain spotted fever is Rickettsia rickettsii. So I used to think earlier that Rocky is some adventurous guy who is climbing the mountain again and again. Rickettsia rickettsii, Rickettsia rickettsii. And a hard guy, some Rocky, hard solid guy. So KFD RMSF plus Indian tick typhus, tick paralysis, tick fever. Every tick thing is transmitted, T thing is transmitted by hard tick, except trench fever, which is by louse. Remember, put. So except trench fever, all T are mostly coming under hard tick. Then deer tick and ixoid tick, they transmit two diseases. One is Lyme disease and other is babesiosis. Babesiosis. What is this two thing? See, in the Lyme disease, you can get this type of lesions. They call it target lesion, bull's eye lesion, सांड की आंख. And in babesiosis, you will see this type of lesion, blue color things, purple color lesions in peripheral smear. This is Maltese cross. So a lot of image-based question come from this part. Maltese cross, target lesion, babesiosis, Lyme disease, both by ixoid and deer tick transmitted. And ixoid tick, deer tick look like hard tick. So this is hard tick, soft tick. What is this? This is definitely hard tick or soft tick. Tell me. You can see the head. So it's hard tick. Hard tick, as I said, RMSF, KFD and all. This is rat flea. Chota Bheem. And this is the Imran Hasmi of insect kingdom, the kissing bug. Why they call it kissing bug? Because it is so turkey. It only like to bite near lip area. Imagine if it like to bite near any other hole. What will you call him then? So this kissing bug, which is redwood bug, actually its name is redwood, is kissing bug. This, if they give an exam, it's very easy to identify. Because kiss लेने के लिए turkey इतना उतावला, it is so anxious to take kiss, so lusty that it is pouting all the time. You can see a head type of thing coming out. That is typical of redwood bug, kissing bug. And which disease they transmit? They transmit only one disease, Jagas disease. Jagas. So there was a student, Kamlesh, who said me this good mnemonic. Sir, ये आसान से याद हो जाएगा. Redwood bug देता है झकास चुम्मा. Redwood bug give झकास kiss. Chumma means kiss. So redwood bug give झकास, very good kiss. झकास kiss, like that you can remember. Plus you will remember the pouting, I hope. Sometimes they can give black color also. Doesn't matter. Main thing is pouting you have to see. So this is a histogram or a multiple bar chart. In a multiple bar chart, there will be gap after fixed interval of time. Like after every 2-3 bar, if there is gap like this, 2 gap, bar and gap, this is a multiple bar. This is multiple bar. But you can see here, gap is not coming at regular interval. So this is a histogram. This too can be confusing. Histogram is for quantitative data which we can measure like weight, height, BP and all. And multiple bar or any bar diagram is for qualitative data. So it's very important to remember qualitative data and quantitative, because qualitative data, if there is 2 or more group, we apply chi-square test. And how to apply identify qualitative data? If the data is of any disease, or the data is in percentage or proportion, or the data is in median and mode, we call it qualitative data, because qualitative is same thing as categorical. Let me explain this thing to you. If I ask you about comparing obesity in 2 group of people, obesity can you measure? No. You can only say to me कि मोटे तो थोड़ा मोटा है, बहुत मोटा है, फटने वाला है, you know, mild obese, moderate or severe obese. You cannot say to me that you are 2.9 obese. So obesity, which is a disease, is qualitative data. And therefore, when we compare obesity of 2 groups, we apply chi-square test. But if let's say you are not comparing obesity, you are comparing weight. Now weight is something which we can measure. So what we can measure is quantitative. And as I said, histogram is for which type of data? Quantitative. So if it is a histogram, quantitative data like weight, height, BP, the data will be in mean. Quantitative data. Sorry for this poor writing. I am going to work on it. My dear Siraj sir has warned me to work quickly on it. So quantitative data and weight we are measuring in 2 groups. We will apply unpaired t-test, which is also known as student t-test. But if say they are measuring the weight before giving drug and after giving drug in 2 group. So if they have written pre-post, before, after match data, then we will apply paired t-test. If they have not used the word in the question pre-post, before, after match, we will not apply paired t-test, which is dependent t-test. We don't apply. If they have written 2 group and there is no pre-post, before, after match written and data is of weight, height, BP, quantitative, we apply unpaired. And if it is 3 or more group and quantitative data is there, we apply ANOVA. So paired answer will be pre-post, before, after match written and data quantitative. Unpaired 2 group, data quantitative. ANOVA 3 group or more, data quantitative. But if the data is disease data, answer will be in 95% cases chi-square test, because disease are categorical. Like hypertension is qualitative data. BP we measure is quantitative. And similarly, anemia is quantitative or qualitative? Anemia is qualitative, because anemia is a disease. Hemoglobin is quantitative. So if they compare anemia, answer will directly be chi-square. If they compare hemoglobin, answer can be any of the paired, unpaired or ANOVA. This is a pie chart which can be used to explain balanced diet to layman also, because it's just express the qualitative data or categorical data in 100% it divide, and 360 angle it try to describe that data. So balanced diet to layman is by this pie chart. Okay. Then the next is, this is the standard normal plot, and on any normal plot where 50-50% data are on both sides, if we apply some rule, it becomes standard normal plot. So what are the rule here? The rule is, first, mean, median, mode all will be in the center 0. Second rule is area under curve will be equal to standard deviation. Standard deviation will be equal to variance. All are equal to 1. So from this part, mostly they ask question. The third rule is between mean plus minus 1 standard deviation. You can see this blue part, 68% area is under mean plus minus 1. And you can see this pink area and blue, pink plus blue, mean plus minus 2 standard deviation will have 95% area under curve. Okay, and if you look at mean plus minus 3 standard deviation, the whole curve, almost 99% value come under it. So this is rule 3. And from this rule 3, the lower part is the 2 formula of confidence interval. Usually in biostat, they give numericals from confidence interval. And remember this 2 formula. But these 2 formula we apply only when population word is not given in the question. If they give population word, then in case of population, we use standard error. Standard deviation is for 3-4 people of the class sample. Standard error is for the whole population. So if they use standard error, if they use the word population, 95% confidence interval population, then the formula will change and the new formula will become mean plus minus 2 standard error, not standard deviation. Okay, and standard error has this formula, standard deviation by under root n or under root pq by n. Why 2 different formula? Because if the data is of disease data, qualitative data will be percentage proportion, we will use pq by n. If the data is quantitative mean, we use standard deviation by under root n. So just I was trying to revise the main formula from which numerical can come. Now this is a line diagram. Line diagram always tell trend of event. Like it can tell secular trend. What is secular trend? Secular trend means just like secular leader. Who is secular leader? The one who is equal to all religion for a long period of time, not just before election, but also after election. So if someone is constantly same, we call it secular. Similarly, in the world, cardiovascular disease is constantly increasing from 1950 till now. It is constantly increasing. So cardiovascular disease is an example of secular trend. And how do we represent trend? We represent trend by line diagram. This is a line diagram. Okay, do remember these 3 questions which come from it. This is box and whisker plot. Why do we use it? It is used to identify outliers. These are outlier which we explain through it. And it's very simple to identify. You can see the box and below the box there is tail, whisker. What is outlier? Let me give you a very good example. Every 2-3 years in UK, they do a survey that how many sexual partner you have lifelong. And usual answer which comes is 2 to 7. But in the same population of UK, some people said 599 sexual partner, 699 sexual partner. So should we include those hunter data in normal population data? No, na. Otherwise, normal population will think कि सारे कर रहे हैं, हम ही नहीं कर रहे हैं. They are doing, I am not doing. So they will get depressed. Na? So we should not include those hunters data in normal population. We should remove those data, calling them outlier. 699 sexual partner went too far. That's outlier. This is identify box and whisker plot. Now one more common question which comes from box and whisker plot is that in the box and whisker plot, they put one danda. They put one bar somewhere. And they ask which type of curve is it. If the bar is below, usually, of course, always 25% will be this side, 75% will be this side. This is the box. If the bar is lower part and we draw an imaginary line, imaginary curve, this imaginary curve has this part as skewed part. Skewed का मतलब टेढ़ा खिंचा हुआ, stretched, bigger part, skewed. And skewed part is towards big number or less number. See, 25 to 75 are bigger number. See, between 25 to 40, there is this straight part, and 40 to 75 are skewed part. And we all know 40 to 75 will be bigger number. So if the skewed part is towards bigger number, or let's say if in your life you are going towards bigger number, more marks, more money, are you positively skewed or negative? Of course, if your marks is increasing, money is increasing, going towards bigger side, you are positively skewed. So similarly, this type of curve, which is on towards our right hand side or which is towards positive side, bigger side, we call it positive skewed curve. So this is positive skewed curve if the bar is below. And if the bar is above, then it will be negative skewed curve. So to remember it, one of my very good student in Jaipur, he came to me in the break and said, sir, I will tell you in a naughty way how to remember it, but don't take my name in the class. I said, tell me, my bro. He said, sir, imagine this bar as penis or thought of sex. Now, when the thought of sex is all the time in our brain, that is the time when we can't focus on study and our marks go negative. So this is negative skewed curve. And when the bar is below the belt, under our control, then we can focus on study. Our marks will increase. We are positive skewed curve. So will you remember it? Danda niche, positive skewed. Danda dimag mein pure samay, negative skewed. Bar up, negative. Bar below, positive. And I was just trying to remember this two formula of positive likelihood ratio and negative likelihood ratio, which I was unable to remember in my MBBS time. The formula is very simple to remember actually by using the same trick. In positive and negative likelihood ratio, both formula, we always write sensitivity by specificity. Sensitivity is above, specificity is below. But in the positive likelihood ratio, just like positive skewed curve, kahan rahega bar? Where is the one minus sign, one bar sign? Bar below the belt, then we are going positive. So if you put one bar below, it becomes positive likelihood ratio. And bar above in the head, negative skewed. So similarly, one bar above, and it will become negative likelihood ratio formula, 1 minus sensitivity by specificity. So put bar below, positive likelihood ratio, positive skewed curve. Put bar above, negative likelihood ratio, negative skewed curve. One more question from this part is skewed curve is, they ask the sequence, mean, median, mode, which one is the sequence? So the sequence is very easy to remember. Positive skewed curve, mean is greatest. Just remember this part. Positive skewed curve, mean is greatest. And always remember कि median बीच का है. Median remain in between mean and mode. So median can never be the greatest or lowest. It is in between. So if mean is greatest, you remember positive skewed. Sequence will become mean, median, mode. क्योंकि median बीच का है. Median will be in the center. And if you remember, mean is greatest in positive skewed. In negative skewed, which one will be greatest? Mode. Because mean is greatest here. Median can never become greatest. So what will be the sequence in negative skewed curve? Mode, then median, because median beech ka hai, and mean. So you need not to mug up the sequence, which is confusing. Just remember like this. In positive skewed, mean is greatest. So mean, median, mode. Negative, mode is greatest. So mode, median, mean. Okay. So this all question can come. I hope you will be able to answer. This is, as I said, forest plot, which we draw in meta-analysis. Now, again, try to answer the same trick. Out of 1, 2, 3, 4, 5 study here, how many are showing positive association? You can see, study this. Lower 2 study. They are not touching odds ratio 1 line. So they are showing positive association because their confidence interval do not include 1 and it is more than 1. But line 1, 2, 3 are touching this odds ratio 1 because they are touching. So all these study are non-significant. Okay. So I hope you will be able to answer this forest plot question. One more thing which we draw in meta-analysis is funnel plot. Funnel plot will have this type of dot here. This is showing study with positive association. This side is showing study with negative association. And on the y-axis, you have standard error. So in meta-analysis, you are combining result of 4, 5 study. If all the 4 study are towards one side positive, this is example of publication bias. And this funnel plot tell us about publication bias. Let me explain this thing. What is this publication bias? See, suppose you are searching any topic on Google. Suppose you are searching by drinking cold water, weight loss occur or not in gym. If someone is drinking cold water, weight loss is there or not. So if you will search this topic, mostly study with positive result only get published in the Nature journal and all the important journal. You will only get those type of studies which are showing positive association. You will only find dots on one side. This is the funnel plot telling about publication bias. Only dots of positive, that yes, weight loss will occur with drinking cold water. Because if weight loss is not occurring by cold water, no one will publish it. And actually, this question has came in previous NEET exam also. Weight loss with cold water is an example of spurious association. Spurious means false association. Like in tribal area, they say that more death occur in hospital. Why? Because serious patient go to hospital for delivery in tribal area. So it's not a real association, it's a fake association, spurious association. And example of spurious association is cold water drinking in the gym lead to weight loss. This is actually not significant weight loss. Some weight loss occur, but it is very insignificant. So the point is, if you found only positive study in funnel plot, that is the problem with meta-analysis and systematic review, that journals only publish those study with positive result. This is publication bias. Whatever you will search, you will get positive result. Suppose you are searching eating grass will increase IQ or not. You will only get positive result mostly. So this is publication bias of meta-analysis funnel plot. And second point which I was teaching here is that cold water in gym is an example of spurious association because it actually do not occur. But when you will search it online, you will find mostly positive study on this topic because negative study no one publish. This is publication bias. Very likely question for INI-CET exam. So next, this is Levy-Jennings chart. What does it check? It check validity and reliability. Validity means accuracy, whether the instrument is giving correct result or not. And reliability means whether the data is repeating it or not. So repeatability or precision is reliability. Like let's say, if in your batch, suppose my friend Hiren Parmar, and whenever Hiren will go on date, he will only focus on his girlfriend. He will not check out other chicks. He will be precise. So the data which is precise, repeating, reproducing, that is reliable data. For example, let's say you have a hemoglobin machine, and in that hemoglobin machine, the correct result which is there in the control solution, the liquid which come with the machine to check whether the machine is okay or not. And I like when you are taking BP of patient, first you measure your own BP. Why? You are willing to check whether the machine is good or not. So there you are using yourself as a control person. So similarly, in a machine which is measuring hemoglobin, if the correct result of the control solution is 10 and your result is coming 7, 7, 7, 7.1, 7.1, so this means your result is precise. This result has high reliability because it is repeating itself. But is this result correct? No, this result is not correct. Correct result is 10. Here it is coming 7. So this is highly precision, but the validity is low. It is not accurate result. Low validity. Okay. So I hope you understand. Validity is accuracy, reliability is repetition. Now suppose the correct result is 10 and our result is coming, let's say like this, 4, 6, then 14, 16, 18, like this. So 4, 6, 14, 16, 18, let's put one more number. 2, 4, 6, 14, 16, 18 is our answer. And correct answer is 10. So if you take average of 2, 4, 6, 14, 16, 18, average will come 10. You can take the average, it will come 10. Mean value is 10. Add all the number, divide them by 6, it will come 10. So average is correct. But is the data is accurate? No, this is wrong data. Like in this above example, it was a wrong data, but average is coming correct. So it can look accurate. It can have high, it looks like it is correct, valid. It can have high validity. But the reliability is not there. Data is not repeating itself. So it has low reliability. So to remember, if data repeat, it's reliable. if data accurate, it's valid. And here the data average can come accurate, but it's not reliable because it's not repeating itself. So this reliability validity we check by Levy-Jennings chart. If the dots are outside +2 standard deviation or outside -2 standard deviation, we say that the machine is not working well. It should come between -2 to +2 standard deviation. Okay. This is the Kaplan-Meier plot which compare that which two intervention is better. Like in recent INI-CET, they gave this question that in UK, US, we asked the cancer patient to choose between 3 methods of treatment of cancer. We write year of survival on x-axis and what is your survival probability. This we write on y-axis. So this survival probability will be something like this one case if the patient go through only surgery. If the patient went through both surgery plus radiotherapy, the survival will be like this. And if the patient went through surgery plus radiotherapy plus chemotherapy, all three, then survival will be much better. So the question which came in INI-CET was, out of this 1, 2, 3, which plot is better? So of course, third plot is better because third plot has more year of survival, more survival probability. So like this in US, UK, we ask the patient to decide. This is known as cafeteria approach. Like in family planning counseling also we do it. We give them all the option and they choose which one is better. So this is Kaplan-Meier plot, step ladder pattern, survival probability. One more thing is, let's say after surgery, some patient is bedridden and some patient are doing exercise. So their survival probability can never be the same. Some patient can have, let's say, 50% survival. Some patient have only 20% survival. So this difference, this range of survival probability, is known as confidence band. The band or the range within which people survive. And confidence band can be two types. One is equal precision band and other is Hall and Wellner band. There are some other type of band also, but this question came in INI-CET 3 years back, that which of the following tells is a confidence band. Which is a confidence band? Option was, is Hall and Wellner a confidence band, unequal precision a confidence band, like that. So unequal precision is not a band. Equal is the band. Correct answer was Hall and Wellner. It is the band. And what is this confidence band? The range of survival probability. Because people who do exercise, they have more survival probability. The people who don't do have less survival probability. So this is one question which was enigmatic. One more question was from Kappa statistics. This question come in NEET INI-CET exam a lot. Statistics. This Kappa statistics tell about inter-observer variance. Suppose I give 100 X-ray to 2 doctors. These 2 doctors, out of these 2 doctors, one doctor said 60 people have TB, other doctor said no, 80 people have TB. So these 2 people differ. How much they are agreeing, that is Kappa statistics. If they agree more, the data quality is better. If they agree less, the data quality is poor. Like if the Kappa statistics value is less than 0.2, it is very poor agreement. If the data is between 0.4 to 0.6, we can call it intermediate agreement. If the data is between 0.2 to 0.4, we call it mild agreement. It is intermediate. And if it is 0.6 to 0.8, we call it's a respectable agreement. It's a moderate agreement. But if the data is having Kappa statistics between 0.8 to 1, we call it very strong agreement. So one question they ask is from the classification. Second, sometimes they give a small numerical from it. So remember the formula of Kappa statistics. Kappa statistics formula is कि observed agreement. What is the expected agreement minus observed agreement divided by the agreement which we found by calculation, and I am also missing the formula actually. because it comes very less. When one exam only the calculation has came. The formula of kappa statistics I am missing. I will take a separate session tomorrow and I will discuss kappa statistics and the margin cutoff in a separate just 5-minute YouTube video. I will post it in the group. Kindly forgive me, I missed that formula. I will make it sure that the formula and classification is from some verified source, and I will discuss this 5-minute topic on YouTube of PW MedEd. If you found any doubt, any question in any topic, you can always let me know on my number and I will record it and I will try to put it in the app on YouTube, of course, for free for everyone. Now, this is the demographic cycle plot which came in NEET 2024 also. The upper line is birth rate, lower right is death rate. This red line is showing population growth. And they ask 3 questions from here. First question, to level it. Second, which part has maximum growth rate? So remember, growth rate is birth rate minus death rate by 10. Why we divide by 10? Because birth rate, death rate are in 1000. Growth rate is a percentage value, it is in 100. So to remove that extra 0, we are dividing by 10. And the question they ask from here is, which part of this demographic cycle has maximum growth rate? So growth rate is birth rate minus death rate. It is maximum in late half of second phase. If you see here, late half of second, this late half of second has maximum growth rate. So here, color. This part, late part of second has maximum growth rate. And where does the growth rate start decreasing? Growth rate start decreasing in early part of third. Here the gap start decreasing. So do remember this, maximum in second phase, start decreasing growth rate in early part of third phase. And very important to remember is, in the first 2 phase, birth rate is high. Birth rate is high in high stationary. Birth rate is also high in early expanding. But birth rate start decreasing in late expanding. And this phase is low stationary, where birth rate, death rate both are almost same. And after this, we will enter into declining phase, where China is there for last 2 years. In the declining, people who take birth is less than people who are dying. Birth is less than death, so the population decline. So remember, phase 1 and 4 are with 0 growth rate because they are high stationary, low stationary. In high stationary, birth rate, death rate both are high. In low stationary, both are low. Main thing we have to remember is between phase cycle, phase 2 and phase 3. And it is very easy to remember difference of phase 2, early expanding and late expanding. In early expanding, birth rate will be high. Late expanding, birth rate start decreasing. Just remember this much. That is the difference. And India belongs to late expanding right now. So do remember this. And this is known as ROC curve, receiver operating curve. When we want to know the cutoff, ideal cutoff for fasting blood sugar is, let's say, 126. How we got that ideal cutoff? So to get that ideal cutoff 126, we use this ROC curve, receiver operating curve, which is between sensitivity and 1 minus specificity. True positive and false positive rate we draw in ROC curve. And this highest line, that is 126. That is taken as ideal cutoff. Second line can be at 110 and this line can be at 90. If I took fasting blood sugar 90 as cutoff, then many of you will also come diabetic. And which type of diabetic you will be? False positive. This is 20 people false positive. And if I test at 90 cutoff, similar 20 people can also be true positive, can have the diabetes also. They will also come more than 90. So at 90 fasting blood sugar cutoff, true positive, false positive, they are both equal. Because they are equal, this at 45-degree angle, so this 90 cutoff is a useless cutoff. And if 50% result will come, then why we are applying the test? We can toss a coin. Head came diabetic, tail came non-diabetic. So we cannot have equal true and false result. That's a wrong cutoff. Then we increase the cutoff to 110. When you increase the cutoff 110, you can see at this red line, false positive has decreased. False positive has decreased from 20 to 10. So 110 is a better cutoff. But at more bigger cutoff, 126, you can see the false positive is only 5. True positive can be same in all of them. But false positive is lowering when we increase the cutoff from 90 to 110 to 126. So the one which has the highest slope of ROC curve is considered as the ideal cutoff. And how do we use ROC curve? What is this use? ROC curve, area of the ROC curve tell us about positive likelihood ratio. So if we look at 126 cutoff, any person who have more than 126 have more positive likelihood of having diabetes. So I am trying to tell you 3 points about ROC curve. First, age-based question, ROC curve. Second, what is the use of ROC curve? It compares from other cutoffs. Which one is an ideal cutoff? The one with highest slope. Why the curve with highest slope is ideal cutoff? Because the curve with highest slope has maximum positive likelihood ratio. And positive likelihood ratio tell us that how many of disease out of positive rate. Disease out of positive rate is positive likelihood ratio. And there are two type of positive rate. One is true positive rate, other is false positive rate. And this true positive rate are the one who have disease. So when we are writing disease out of positive rate, we write true positive above, false positive below. Now true positive rate is known as sensitivity and false positive rate is known as 1 minus specificity. That is why the formula of positive likelihood ratio is danda niche, 1 bar below, focus on the study better, positive likelihood ratio. And why the slope is telling ideal cutoff? Why the slope has maximum positive likelihood ratio? Because slope of this curve, slope means y by x. Y by x is the slope. And what is there on the y-axis? On the y-axis, we have sensitivity. So y-axis, we have sensitivity. And what is on the x-axis? This side, 1 minus specificity. X-axis is 1 minus specificity. So why the slope is showing positive likelihood ratio? Because on the y-axis we have sensitivity, on the x-axis we have 1 minus specificity. So this is complete ROC curve concept. If it is clear, I am happy. If not, you can use my number which I gave in the session, or you can download the Telegram group of PW and you can ask question there. And I will explain you this topic in detail. If you want, you can message me. I will make it a separate video also for that. This is the population pyramid. It don't just tell about age, it also tell about sex distribution. Like here, male and female, you use sex also. And they have asked this question that broader base population pyramid, this is showing high fertility rate or low fertility rate. So if there is broader base, it is high fertility rate. And this high fertility rate population pyramid is the population pyramid for developing country like India. So when we talk about population pyramid of developing country, पूछते भी हैं किसका है सीधा खड़ा pyramid, upright pyramidal. So for developing country, it is upright pyramidal, सीधा खड़ा है. Developing country will be having population pyramid like this. Yeah, सीधा खड़ा है ना, broader base, bada base. So this was something which shown in that animal movie also. And the ex of Deepika, Ranbir Kapoor, was seeing this actress Rashmika from the backside and said, "Ki you have big base. It means you will produce good children." And I was watching that movie. I was saying, "Hey, you are objectifying female." But just after that movie, 1-2 weeks back, my wife, I was walking in the room and my wife said, "Baby, you have cute bum," to me. So it's not that only female objectify, male objectify female, female also objectify male. So it's okay. And from that day till now, I am taking all the class in standing mode to make my bum cuter. So remember, big base, high fertility rate, developing country, upright pyramidal, and it tell age, sex, both distribution. And the country, what is this shape? This is a spindle shaped. Spindle. Spindle means bigger at the center, tapering at the both the side. Student said, "Sir, just like you, big in the center, tapering in both side." So that is spindle shape for developed country where children are less and it is equal to middle age nowadays. So this type of spindle shaped population pyramid is for developed country. डेवलपिंग कंट्री का सीधा खड़ा, स्ट्रेट pyramidal, upright pyramidal. This is condom or female condom, male condom. Female condom because it has two rings. Female condom is made up of latex or polyurethane. Female condom is made up of polyurethane. Male condom is made up of latex. Which one has higher failure rate? Female condom has higher failure rate because the failure rate is varying, but it has higher failure rate, higher Pearl index. Why? Because if I am a female and after sex I am removing my condom and some sperm will fall, it can cause pregnancy. But if I am removing a male condom and any sperm fall on the ground, suddenly a child will not germinate. Na? So female condom has less chance, male condom has less failure rate, female condom has more chance of failure and pregnancy. But material is also different and number of ring also you can use for differentiation. This is second generation IUCD or third generation. The name of this IUCD is multi-load 375. And I was thinking early in MBBS that because it is multi-load, so it has hormone loaded, it is third. No, it is second generation IUCD. How will you identify second and third generation? Very simple. Third generation will have hormone in it. So if you see plastic thing, only under plastic you can keep hormone. Third generation will have plastic. If you see metallic, it is either second generation or second generation. Because first generation, they have asked this question by image based question of first generation also. First generation IUCD was this सांप type का snake like population, this pyramid, this IUCD first generation, we call it Lipley's loop. And you know what was the main problem with Lipley's loop? ये loop से निकल जाता था. It has very high expulsion rate because you can see there is no fixed point of attachment. So Lipley's loop is old, we don't use. Second generation will have, of course, multi-load 375 which you saw, and second generation will also have this copper T380Ag which protect for 10 years. They can ask what is this 380? 380 is the surface area in millimeter square. And if you have copper T 200 Ag or Nova T or multi-load 375, all these three protect for 4 to 5 years. And these 4 are second generation IUCD. So when you see metal, second generation for sure. And this image is copper T. But if you see plastic thing, this is third generation, which can be Mirena or Progesta cert. Mirena protect for 5 to 7 years. Progesta cert protect for 1 year. So these are third generation IUCD, plastic type. And this is diaphragm or vaginal sponge. This is definitely diaphragm. Vaginal sponge will be different, spongy. But in diaphragm and vaginal sponge, these two are barrier contraception method. And which spermicidal cream they use in it? So the spermicidal agent which we use is, this is the mechanism of action. They are barrier and they also kill the sperm. So for the spermicidal action, they have the chemical nunnu-jan lele, nonogylinol. And all the male in the class must remember their childhood incidents where their nunnu caught in the pant zip. And so nunnu-jan lele, that was the incidence. That is the chemical here, nunnu-gylinol. I remember my incidents and I got caught and they put me in dining table, but my father suddenly came and put it down. And I was relieved. But due to that terror, I did not use chain pant till my 12th class. So this is one more question which can come. If they have case and control, disease and non-disease as the two group, obese, non-obese, it is case control, simple. If they have exposed, non-exposed, risk factor present, absent, karan hai, karan nahi hai, the cause present, absent, it is cohort. Okay, cohort. And cohort here is concurrent cohort because two group exposed, non-exposed are going concurrently. But if they say that we are starting from this present moment and starting from present moment here, but study has two group in the past, this is retrospective cohort. Remember, in the cohort, retrospective cohort, they will use the word past written data. If you found in any question that we are comparing people based on past written record or past questionnaire, written questionnaire, past job data, that is retrospective cohort, only past data. Like for example, suppose you got radiology branch and your neighbor came and said ki ha, don't you know that based on 10-year work record data, radiology staff has 1.2 times more risk of testicular cancer? What is this based on? Based on 10-year work record data. So if someone came and said based on 10-year work record data, more chance of cancer is there in radiology staff. This 10-year data is from the past. They started a study now, but they are using the data of the past, written data. So this is retrospective or historical cohort. You can use the word RH, retrospective and historical, where we start now, but two group in the past. Now suppose you took MDMS and you said, I will disprove this theory. This is not exactly correct, because mainly radiology staff has access to their testing. So in their colleague study, they become the control, and therefore they go through many scanning. So maybe out of 10,000 people in radiology staff, 10,000 other staff, if one cancer came more in radiology staff, still it will be 1.2. So it's not a very big risk. So then you thought to disprove this, when I will take MDMS, I will do this study. And you took MDMS, and for future 3 years, you compare the two group, radiology and other staff, and you find out that actually the relative risk is just 1. That means actually there is no association. So this you did by future 3 study. This is cohort. Future 3 study is simple concurrent cohort. But suppose along with future 3 year, you also use data of past 10 year. So because you use both the data, 10 year and future, both thing is there. Now you will call it as mixed cohort, ambidextrous cohort, or nested case control. So the mnemonic can be RH positive man, to remember all the things. If it is R and H, if only past data is there, then we call it retrospective historical. Only past data, no future thing. But if you mix past and future, both, then it is mixed now. It means you are going in forward direction and backward direction both. So we call it ambidextrous. And why we call it nested case control? See, which is the hard work? 3-year cohort is the hard work. Past 10 data is in the computer. We can get it by the click of a simple computer. Main work is future follow-up, tough work. And in that cohort, का पीछे के डेटा को घुसा दिया गया है, पीछे के केस कंट्रोल के डेटा ने घोंसला बना लिया है. In the 3-year follow-up data, past written record data is inserted, nested. So that's why we call it nested case control, because case control is inserted in cohort, nested in cohort. So these are the 3 names, man and here RH, and we all know ABO incompatibility occur if the male is RH positive, female is RH negative. So the mnemonic can be RH positive man. RH we go backside, man, you know na, man can go any side. So man is both backward and forward. I hope you will remember this name and classification. A lot of question coming from this. If you have randomized allocation, that is RCT. If this instrument they gave, this is kaata laga, hai laga, kaata thermometer. You know, kaata is a Hindi word which means thrown, and thrown will always be long. So if they gave long, it is kaata. And if they gave this type of thing, circular like this is globe thermometer. Because globe is circular. If they say globe thermometer measure only one thing, radiation temperature, circular. But kaata thorn will be long. And what does kaata thermometer measure? Kaata thermometer measure 2 things, cooling power and air velocity. Now they can ask which one is more important for kaata to measure. So Park has written that kaata thermometer is better measuring air velocity. If air velocity and cooling power both are there, your answer should be air velocity, not cooling power. Cooling power it measure, but first choice is air velocity, second choice is cooling power. Okay, this is the second part. And better is air velocity. Similarly, they have asked that for the detection of sanguarine, which occur in epidemic dropsy, which occur by eating contaminated mustard oil. Mustard field you must have seen in Sarah Khan movie. So in that mustard, if Argemone mexicana seed mix, it can lead to bilateral pitting edema. And the poison is sanguarine. To detect sanguarine, we can do both the test, nitric acid test and paper chromatography test. They ask which test is better in last NEET. So for epidemic dropsy, which is in mustard oil thing, the poison is sanguarine. How to remember? S for sanguarine, S for sleeping. And when you sleep, there will be dropping of eyelid, dropsy. Symptom is also pitting edema, dropsy. So in this sanguarine, better detection is by nitric acid test. Paper chromatography can also be used, but first preference is nitric acid test. So both this question came in last NEET, I hope you remember. And to differentiate between endemic ascites and epidemic dropsy, it's very easy. See, when I say ascites, A for ascites, A for abdomen. Ascites has abdominal, abdomen is known as in Hindi as pate. Pate, this is pate, abdomen. So pate swollen, abdomen swollen is ascites. And the disease is known as endemic ascites, which occur by eating Crotalaria plant mixed with Panicum miliare. So endemic ascites is endemic. And the poison is pyrrozolidine. See how much it is correlated. When I say endemic ascites, the poison is pyrrozolidine, and P is for pyrrozolidine, P is for pate, abdomen. And we all know in ascites what swell? Pate or abdomen swell. So endemic ascites is by pyrrozolidine, which has pate swelling, abdomen swelling. And it occurs by which plant? As I said, Crotalaria plant mixed with Panicum miliare. Crotalaria को गांव में कहते हैं झुनझुनिया है ना. In rural area, if you are in silent mode, sometime in sound nature this sound comes jun 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 jun. This sound is due to this Crotalaria plant, which has big covering, big kernel, small seed. So when wind blow, it produces the sound jun 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 jun. So we call it junjunia, and this is local in our country, in rural area, endemic, and it has ascites. Poison is pyrrozolidine. So ascites has pyrrozolidine, and dropsy, epidemic dropsy has sleeping, sanguarine dropsy, which has bilateral pitting edema as symptom, and dropsy is due to mustard oil mixed with Argemone mexicana. So I hope you will remember these differences of food poisoning agent, of Kata and globe thermometer, and you will remember Kata thermometer is more better for air velocity, and nitric acid test is better for sanguarine detection in epidemic dropsy. So this was the main areas of image-based question, and of course the session, in this session I tried to cover the whole topics of those images, and I hope you will revise previous year question of NEET and INI-CET in this last time. Don't waste in doing modules. Don't waste your time because modules you cannot revise those questions which you did correct. Try to do it year wise, and don't in the last, I think in the last 20-30 days when you are doing PYQ, try to do it year wise, because if you do patho now, next turn of patho will come very late. But if you're doing year wise question, you can revise those 5-6 year question in last days, and your score will improve drastically. So for both NEET, FMG and INI-CET, all these 3 exam, I request you, please, every day, the real exam timing, suppose it is 9 to 4 for FMG, 9 to 1 for NEET or INI-CET, in that time, please practice only previous year questions year wise. And in that time, do not open notes and videos, because if every day you will practice on the same time, in the real exam, there will be less anxiety, less thing, because you are in a mode to do question and that time. So use the exam time in practicing PYQs with options. And in this last month, just try to do maximum previous year questions year wise to maximum year and revise them. That will be the most effective method of increasing your score. It can increase by even 20%, 10 to 20% in last 5 to 7 days. So don't underestimate the power of last 5 to 7 days, and enjoy the journey of growth. Love you all. Thank you for listening till now. Thank you so much. Hasta la vista. Das ka dhaniya.